Welcome, everyone, and thank you for joining our live stream today. As you know, September is PCOS Awareness Month, so we thought it'd only be fitting for us to have our live stream today be a conversation about Polycystic Ovary Syndrome. This topic has gained a lot of attention over the recent years as this metabolic endocrine disorder impacts many women of childbearing age. I'm Dr. Todd Griffin. I'm Interim Vice Dean for Clinical Affairs and Vice President for Clinical Services. I'm also Professor and Chair of the Department of Obstetrics, Gynecology, and Reproductive Medicine here at Stony Brook. I'm joined today by a panel of four experts from Stony Brook Medicine: Dr. Stefanie Cardamone, Dr. Fatima Daoud, Dr. Adrian Houghton, and Dr. Deirdre Eschler. And I want to thank you again for participating in this important panel. And I think we'll just get started. So let's start with you, Dr. Eschler. Let's talk about really what is PCOS and what causes it.
Yeah, so PCOS is actually one of the most common endocrine disorders in women. It stands for Polycystic Ovary Syndrome. And the exact cause is actually not known, but it's thought to be both a combination of genetics and environment that will cause PCOS. There is a hormone imbalance that leads to an increase in the male hormone called the androgens at higher levels. And if you could show figure 1, please. So at the ovarian level, on the left, you can see you can get a thickened capsule or surrounding part of the ovary. This prevents one egg from being released every month. And as this happens, you can get a collection of eggs or follicles building up within the ovary. It creates the appearance of what looks like multiple tiny cysts on ultrasound, hence the name Polycystic Ovary Syndrome.
So, Dr. Daoud, do you have anything else to add about PCOS?
Well, PCOS is a lot more common than we think. Just in Suffolk County alone, we estimate about 60,000 women have PCOS. So that's about 1 in 10 women of childbearing age. Despite this being so common, it's still a very misunderstood condition by both medical professionals and patients alike.
So as we know, this is really a multidisciplinary disorder. It really is a systemic disorder. And that's why we have this panel of experts today, including a pediatric adolescent gynecologist, an adult gynecologist, a dermatologist, as well as an endocrinologist to really talk about this. And I thought we'd start first again with Dr. Cardamone and talk about really how does PCOS really present in the pediatric adolescent population?
So polycystic ovary syndrome really can develop in somebody of any age, really. It's not uncommon, however, to start to see the early signs and symptoms potentially during adolescence. And one of the first things that sort of come into my office is folks coming in with irregular periods, particularly after the first few menarchal years, where there's irregular bleeding, sometimes skipped menses, or sometimes no menses at all.
And Dr. Daoud, how about your adult patients? How do they usually present? What are the different things that you're dealing with?
Sure. So if we can actually show slide 1. When we talk about PCOS, PCOS is one of the most common causes of female infertility in women of childbearing age. And it doesn't strictly affect the gynecologic organs despite its name. So it's a condition that can put people at higher risk of diabetes, high blood pressure, pregnancy complications, that are a higher risk of endometrial cancer, which is cancer of the lining of the uterus, heart disease. And it's also linked to behavioral health and mental health issues, depression, anxiety, and issues with body image.
Great, thank you so much. And Dr. Houghton, can you talk a little about some of the dermatologic conditions we see? I think this is some of the things that are more distressing for patients, and I think it's important for them to understand it.
Of course. Photos 2 and 3, please. The increased production of androgen by the ovaries increases the oiliness of the skin. The hormonal imbalance of PCOS also often causes acne that's concentrated in the lower 1/3 of the face, as depicted in this picture here and the one before, which show patients with large erythematous and sometimes very tender and deep lesions known as cysts along the jawline. If we can move to photos 4 and 5, please. In addition, the hormonal imbalances in PCOS cause hirsutism. Hirsutism is an abnormal growth of hair on a woman's body, most commonly noted on the face, and it can be very bothersome to patients when it's noted on the chin or the upper lip. In addition, we can see it in patients on their arms as seen here, as well as the chest and the back. Lastly, photo 6, please. Women with PCOS often notice thinning of their hair at the crown. Once again, this is caused by the increased androgen levels and causes thinning, which is described as female pattern or androgenic alopecia.
Great, thank you very much. And if Dr. Eschler, if you could talk really about PCOS, that would be really helpful for the audience.
Yeah, I actually don't think we can talk about PCOS without talking about the metabolic complications that are associated with, and I would argue that this is a metabolic disorder as well. As Dr. Dayoud had alluded to, there is an increased prevalence of insulin resistance and being either overweight or obese in women with PCOS. This can put them at risk for the metabolic syndrome, for high blood pressure, for high cholesterol, and type 2 diabetes.
And I think one of the things that is often difficult for practitioners or even for patients is really understanding is how PCOS is diagnosed. It can often be misdiagnosed, and many of the symptoms can have a lot of different causes. So let's talk really about how you make the diagnosis. What are the different criteria that we use to help determine whether or not the patient has PCOS? So Dr. Cardamone, why don't you jump in on that one?
The diagnosis of PCOS can be quite challenging, and I would argue that's even more true in the adolescent population. But really, as clinicians and providers, this diagnosis is made based on a constellation of things, including a very detailed history about menstrual history and some of the other associated symptoms we might be interested in knowing about, a physical exam, laboratory testing, and in adult women as well, a pelvic ultrasound. Really, we're looking for three main components to this disorder, one of them being menstrual dysfunction. So again, that can be skipped periods, periods coming too close together, or no periods at all. The other component of this, if you could also show slide 2, thank you, is really about androgens, which have been mentioned before. So either lab tests showing elevated androgen levels, or sometimes this manifests through signs and symptoms. So that might mean persistent acne, hirsutism or excess hair growth that we spoke about, and sometimes even thinning scalp hair. The last criteria is looking at sonogram. And really what we're looking for is the appearance of the ovaries. So an enlarged ovarian volume, as well as multiple follicles or small cysts on the ovaries to make that diagnosis.
So I think one of the also important things is how is PCOS treated? And one of the things that we see often is that many women, because of the name Polycystic Ovary Syndrome, really only see their gynecologist. They don't. So in that case, they're not often treated for all the different aspects of the disease. And many of the OBGYNs truly don't have the expertise to treat the metabolic endocrine disorders that Dr. Eschler was hinting at earlier on. So it's more than just really correcting the menstrual cycles. It's more than really correcting the infertility. It's really about treating the whole patient. And one of the things we're excited here at Stony Brook is that we were able to develop a polycystic ovary center, which allows us to treat the disease from a multidisciplinary approach and have the experts that you're seeing today really help patients through this. So I thought maybe Dr. Dawood, you could talk a little about our PCOS center.
Sure. So thanks to a generous donation from Ivana Stolnik, who's a PCOS patient herself, Stony Brook has developed a PCOS Center of Excellence, which I'm really excited about. And I find that patients are really excited about too. We're creating a medical home that's centered around the needs of a PCOS patient. And the goal is to provide a faster diagnosis of PCOS by people who are very familiar with the condition, and also be able to provide access to an array of medical professionals that the PCOS patient may need throughout their lives. And the way that a lot of us like to focus our visits are, what are your priorities and what would you like addressed? And so that we can send you to the appropriate specialist that you need to see in a timely fashion. The clinical team will include, of course, gynecologists, primary care doctors, endocrinologists, fertility experts, cardiologists, nutritionists, dermatologists, mental health care providers, and more. And with navigating this new way of approaching PCOS, as opposed to, hey, here's a birth control pill and lose some weight, we have a nurse navigator for the PCOS Center. So if you could show slide 3, please. So Ashley Budden, she serves as the point person. We call her the nurse navigator of the PCOS Center, and she is in direct contact with the patients and helps them navigate and answer their questions throughout this journey. And then, of course, Kathy Munkle, who's the center coordinator, who helps our patients get their referrals, get their appointments, so that there's less lag time in between. Although there's no cure for PCOS permanently, there are many treatments that are available to help reduce the impact of PCOS that it can have on health, fertility, and overall appearance. I always tell patients, I only want to do what's going to make you happy. And so we kind of just have the privilege and opportunity to join people on their journey as they are navigating this condition.
And I think that's a really important point that Dr. Dawood makes, is that, you know, for patients, PCOS really does have different ways of presenting. So for some patients, it's more the irregular periods, and sometimes it's more the hirsutism or excess hair growth. And it really is that working with the patient to understand what is important for them is going to be really important. And I just want to remind the audience that if anybody wants to ask any questions, they can post those in the comments, and we'll be able to answer any questions as we're going through this. So let's talk about some of the different treatments, and let's talk about how we deal with some of these issues. So Dr. Cardamone, can you talk a little about how we treat the irregular periods and potentially fertility as well?
Sure. So certainly one of the most common things I deal with in my adolescence is dealing with irregular periods or abnormal bleeding, which can cause a lot of distress, anxiety about going to school and having heavy bleeding and prolonged bleeding, and it's unpredictable. And so that's certainly a challenge for a lot of patients. And often we'll talk about using hormonal management, whether that's oral contraceptive pills, oral progestins, or sometimes even intrauterine progestins to deal with prolonged, heavy, unpredictable bleeding. For an older patient that's potentially struggling with subfertility, it's possible to involve a fertility specialist who could walk through the options in terms of fertility management and medications that might help with ovulation and management of that.
Yeah, and if we could show slide 4, I think it is important for the PCOS patients to understand that if they do not have any other fertility issues, that we are able to help them get pregnant. So even though they may have a difficulty with ovulation, for a majority or almost all the patients, through doing different techniques, we are able to help them get pregnant. I think that's a really important thing, because many times PCOS patients may think that fertility may become difficult for them. And then I thought maybe it'd be good because it is very distressing for patients, is for Dr. Houghton to talk about how do we treat some of the different skin-related issues from PCOS.
Of course. So for those patients who have the skin manifestations of PCOS, spironolactone, which decreases the level of androgens, has been shown to be effective to treat both acne, hirsutism, and female pattern hair loss. If we can look at photos 7 and 8, please. In addition, for those patients who have hirsutism affecting increased body hair, as we talked about before, in addition to spironolactone, laser hair removal can be an effective treatment as well. If we can move on to slide number 9. And then lastly, when we look at female pattern hair loss, a lot of patients, in addition to the anti-androgen medications, they want to be more aggressive. And the latest technological advancement that we have for treating hair loss or thinning hair is what's called platelet-rich plasma injections, also known as PRP. PRP is a very safe and completely non-surgical and natural medical procedure. We actually take the patient's blood and spin it down in a centrifuge. After that, we pipette off the platelet-rich plasma and then re-inject it into the patient's scalp. And platelet-rich plasma contains concentrated growth factors and does a great job of stimulating hair growth, and so is a wonderful adjunctive treatment for patients.
So I'm going to go on to one of the questions from the audience. So one of the questions was, who has access to the PCOS Center, and is it just for Stony Brook patients? So I thought it'd be good if maybe Dr. Dawood, you could talk about that.
So we are happy to welcome anyone to the PCOS Center who would either like to be evaluated for PCOS or has a known diagnosis of PCOS. You do not have to be an already existing Stony Brook patient. For a number of our patients, they already get all of their care with Stony Brook doctors, but even those who don't, a lot of them get their PCOS care with us and choose to continue care with their own doctors. Either one is fine. We only want to do what makes you more comfortable.
That's great. And then another question from the audience, and I'll direct this one to Dr. Houghton, is what happens at menopause? Do the skin and hair symptoms resolve themselves, or what happens then?
So there's a variety of changes. For some patients, we may see some resolution of some of the skin manifestations, such as acne, or it may become less severe. For most patients, the hair loss will only progress because as we see patients who don't have a history of PCOS, many patients will develop female pattern or androgenic alopecia with time as well. So if you're someone who's menopausal or postmenopausal, it may be in your best interest to see a dermatologist if your hair loss is bothering you.
That's great. And then I think I'd like to have Dr. Eschler comment really about how do we treat the insulin resistance, and then some of the, probably one of the more difficult things for our PCOS patients is really weight gain.
Sure. Yeah. So the first step, you really can't talk about, again, PCOS without talking about the endocrine or metabolic complications from it. And the first step in treating both the what can be distressing weight issues as well as the insulin resistance is focusing on lifestyle changes, right? And so this is through having a healthy diet. And I always focus with patients, it's not about dieting, it's about changing how you think about food or what you're eating. So through healthy eating and through exercise, and even just losing 5 to 10% of your body weight can have a dramatic impact actually on many aspects of PCOS. So sometimes if a patient's comfortable talking about their weight and they want to talk about it, we'll figure out what their weight is and what 5% of that weight would be in order to achieve that goal. I try to do it all patient-centered and patient-directed. So if a patient doesn't want to use an app to lose weight or doesn't want to see our nutritionist, I'm not going to send them down that road. For insulin resistance, sometimes we do end up having to use a medication, and most commonly we would use a medication called metformin.
That's great. And I do think that patients also, do need to understand that it is much more difficult for PCOS patients to manage weight than a non-PCOS patient, just because of the metabolic endocrine part of the disorder. So it is a very difficult struggle for many patients. Another question from the audience is, and I'll probably take this one, are there any limitations in terms of fertility treatments for patients with PCOS? And it is important to realize that obviously fertility can be affected by a number of different things. So one of the questions is around age. So obviously, as you are getting older, there are going to be other reasons why you may have infertility not related to PCOS. So it's really important, again, as we see patients, especially in their teenage years or early 20s, is that we're aware they have PCOS because we can start planning for that and making sure that age does not become an issue. Weight or BMI was also asked. And obviously, weight or BMI can sometimes affect infertility as well, though usually with PCOS, it's something that we're able to treat. Again, weight and BMI can also affect pregnancy as well. So again, it's something that we really wanted. The earlier we can have intervention, the better success we can have from a fertility perspective, as well as have for a pregnancy outcome. And then we have a second question, and I'll put this one towards Dr. Cardamone, is patient is asking, her daughter is 17 and GYN said she may have PCOS based on irregular periods. She's also gained a lot of weight in the last 2 years. Should I bring her to an endocrinologist to test her hormones?
Yeah, sure. So, I think my first question, if I was seeing your daughter, is how irregular are they, is number one. I think sometimes there's a little bit of misconception in terms of what's normal and not normal. I think it would absolutely be reasonable to see either a pediatric endocrinologist or if you have access to adolescent gynecology or an adult gynecologist to talk more and get more information. And if any testing seems to be indicated, to get things looked into.
And I think that, and again, I think that's important because, many adolescents can have irregular periods that is still just a maturation of their normal hormones. So it's really, it becomes a lot more difficult in the adolescent patient population to make sure, is this PCOS? Is this something else? So again, I think it is important to get seen by the experts to really, understand what's important. Another question from the audience is, where is the PCOS center located? So one of the things we have done at Stony Brook Medicine is pretty much all the providers that provide care for patients with PCOS, it is still a virtual center, but many of the providers are out of our Comac facility. So that's located in Comac. I think it's 500 Comac Road. So that's a place where you could go to see most of the providers. However, there are times where we may see you in other locations. So it is still a virtual center to some extent. Where you may see many of the doctors in one place, but there's a possibility you may have to go to a different office as well. Another question from the audience is, when would an ovarian drilling procedure be indicated for a patient? So this is obviously somebody who is a little more understanding of the infertility process. Ovarian drilling is basically where, because the capsule of the ovary is thickened, in the past, we would basically make a hole through that capsule in order to help the patients ovulate. That's something we don't do that much anymore. Most of the time, we're still able to accomplish fertility through using the different medications, though it is still reserved for patients who are resistant to that. So I am, as a minimally invasive GYN surgeon, have done that in the past, so we have not had to do it as much more recently. So it's something we reserve for rare patients. And then I'm going to give a question to Dr. Eschler. Is metformin an option for PCOS patients to help with weight gain, even if that patient is not diabetic?
Yeah, so that's an excellent question. And so certainly if the most important thing that we'll look at, if there's any signs of insulin resistance, we could do this with a glucose tolerance test, or we could do it sometimes looking at just a simple blood test called the hemoglobin A1C. If somebody has signs of insulin resistance, definitely metformin should be a consideration to start it. There are some women who, metformin in general is a weight neutral medication, meaning most people who start on it and the bigger outcome shows that it's weight neutral, but there are some people who do lose weight for it. And anecdotally, I do have a good amount of patients with PCOS who have lost weight with metformin, and sometimes actually can begin to ovulate on their own as well.
That's great. I think it's also important for people to realize that the PCOS Center, even though right now it is focused on clinical, meaning how do we treat patients with PCOS, we're also looking at the research. As Stony Brook Medicine is a research and academic medical center, we are trying to understand more about the disease process. So as we have continued to grow our population of PCOS patients, we are engaging them in different research opportunities for us to have a further understanding of the disease, and hopefully, someday figure out a better way of treating it. Hopefully, maybe have a cure in the future. So I think that's a really important thing to understand too, which is different than many other places. We're not only looking at how we do things clinically, but we're also trying to look at how do we advance the science around PCOS. At this point, I wanted to open it up to my panel and see if they had any other comments or any other things that they wanted to highlight that they thought was important.
Yeah, I think it's just exciting that we have this PCOS center here at Stony Brook. We all work together. We communicate with each other. There's a really wonderful flow for patients, I think, coming here. So far, everybody, since the center is opened, who's been part of it has been really excited, not just physicians and clinicians, but patients as well. And it's not just something where you can focus on one component of it. It really has to be what we call multidisciplinary approach, where we all talk together and patients are seen by a couple of us specialists.
Yeah, and I think that's a really important point, Dr. Eschler, because having seen patients myself, they are very happy because if they feel like they've never been explained the entire disease process before. So the educational part of this is really important because, for whether it's an adolescent patient, a young adult, or even an older adult, there are things that they're going to have to do to help make their lives healthier overall, and really to minimize the risks of them having more long-term complications. So to me, it's been one of the more rewarding things is actually doing a lot of the education with the patients. I know that Dr. Cardamone has felt that way, and I know Dr. Dawood has, and I'm sure you guys have as well. When you're dealing with the patients, they're very thankful for the fact that someone's taking the time to explain this to them. So I think that's a critical part of our center. All right, I don't see any other questions in the chat. So at this point, I think we're going to close out our discussion. I want to really thank everybody for tuning in. We hope you found this discussion informative. With the proper diagnosis, PCOS is really a disorder that is manageable. If you'd like to schedule an appointment, you can call us at 631-444-4686. We do have a website, and that we're putting the website up on the screen. And you can also follow us on Facebook at SBM OBGYN. So again, I really want to thank everybody for attending today. I want to thank our panel of experts. I know this is just the beginning of our PCOS Center of Excellence, and I'm really excited about not only the things we're going to do from a clinical perspective, but also what we're going to do from a research perspective.